technology practices and lead the global capability centers offering at Healthhark.
My name is Riya Doshi, and right now I'm working in capacity of an engagement manager at Healthhark.
Hi everyone, this is Sachin Baghadiya. I'm currently positioned as a senior consultant at Healthark, and it's been almost 5 years that I have been associated with this firm.
So yes, over the past few years while working with life sciences organization, we realized one interesting thing. The conversation around GCCs in India has changed fundamentally. Now, a decade ago, GCCs were known for their operational scale and cost arbitrage, but today GCCs are being built for driving innovation, digital platforms, clinical analytics, and regulatory sciences for the global enterprises. Also, we realized that more than 70% of these life sciences sectors already have AI embedded in their systems. India boasts a powerhouse of talent, which is about to cross 420,000 by 2030, which is employed in the life sciences GCCs across India. And we felt that this is the right moment that we, step back and analyze what are the powerhouses or the driving factors in enabling this growth in India. And in this white paper, we describe these factors as the 3T turbine, the triple T turbine, the talent, technology, and transformation. India's deep scientific pool, rapid adoption of AI and digital technologies, and strong policy support are creating a powerful flywheel for GCC growth. And our goal with this white paper is not just to document the growth story, but to also help industry leaders understand how India is evolving from a delivery hub into a global co-innovation center for life sciences.
So while creating this whole process of white paper, we spoke to so many global life science GCC leaders who mentioned that few years back their life science GCC Indian teams were just supporting the operations, but today they influence global decision. I think this in itself is a pivotal moment. Today about 60% of global life science GCC footprint is anchored in India. Several multinational companies now run significant parts of their global operations from here. But what's particularly fascinating in life science is that evolution, how it looks different from other GCCs. In many industries, several companies start by offshoring less complex work and then gradually move up to the value chain. But in life science, we are seeing this totally opposite. The most of the critical parts of this value chain like R&D, clinical evidence generation, regulatory intelligence are being anchored in India today. That's largely because of the talent ecosystem we have over here, and not just the talent ecosystem, the technology has kind of accelerated this innovation. So it's an exciting time now to drive from scale to capabilities.
When developing this white paper, our first point was to look at GCC landscape as an overall ecosystem. So I think that is going beyond companies' individualistic perspective and look at the ecosystem, how the ecosystem is maturing, how the growth trajectory is, right? So I think examining different perspectives was something that we really focused on. I think there were enabling layers as well that we looked at. So for example, talent pipeline, infrastructural readiness, technological adaptation, and regulatory shift. How these enablers are coming together to overall shape the growth momentum for GCC landscape within India. To take this further, we complemented our ecosystem with inputs from industry leaders and GCC pioneers to look at how the evolving company level strategies are shaping the overall maturity of the industry. Basis of this, we also created certain aspects through which we created a maturity index with 4 parameters. One of them was software engineering maturity. Another was cost competitiveness, followed by depth of tech talent pool and ease of doing business. To assess the overall maturity of India's healthcare and life sciences GCCs, we also took the growth momentum to another level with 3 different pillars, that is tech, talent, technology, and transformation, which together helped us understand the overall growth trajectory for GCCs in India. Not just that, we also looked at how these elements influence each step of the value chain to not just scale the current growth, but also look at how the growth is going to be over the next decade. I think one of the most powerful insights that we derived was that next phase of India's GCC landscape and the growth of it is actually shaped by specialized clusters. Different regions are emerging with different strengths, clinical, digital, regulatory, and analytics. Indian GCCs are actually structurally shifting from delivery centers to innovation hubs. I'd say that India currently has more than 300,000 professionals working across these GCCs, and that is going to be around 420,000 by 2030. Also, hiring is being more specialized towards specialized roles, with up to 45% of new positions are being created across AI, clinical analytics, and digital health. Another important insight that we came across during our research was that increasing integration of advanced technology is actually reshaping the GCC landscape. Over 70% of life sciences GCCs have embedded AI, data, and advanced analytics into their core workflows. I think these trends indicate that GCC ecosystem is actually deeply specialized based on a global platform.
From my understanding, I think India's life sciences and healthcare GCCs are currently at a strategic inflection point where India is hosting around 60% of the global GCCs. And these companies are increasingly positioning their India centers as critical nodes within their global operating models. I'd say there are two strategic shifts to this. Number one, a transition from operational models to capability-led ownership models. GCCs are no longer just back-end operational support centers, but they are handling complex mandates across clinical development, R&D, and regulatory. The second shift is about evolving operating models. Instead of relying on just one single center, companies are exploring distributed structures. Hub and spoke model is beginning to emerge as an option to access specialized talent and manage ecosystem pressures.
So over the next 5 to 10 years, the life sciences and healthcare GCC ecosystem in India has now become much more larger and has become much more integrated. Now, if we look at the ecosystem today, it is around 18 billion, but it is expected to reach $100 billion, which means $80 to $85 billion of more incremental growth, which is a phenomenal growth. But what will truly define the next decade of this life sciences GCC growth in India is how this GCC's model will evolve. So basically we see three fundamental shifts which will happen in the next decade. First, that we'll see more organization moving towards a distributed hub model, wherein there will be a primary hub complemented by a secondary innovation center in emerging cities to access newer talent pool and manage cost pressures. Second, we will also see a greater leadership localization with more global roles and decision-making authority anchored out of India rather than just operational responsibilities. And finally, the most successful GCCs will increasingly operate as integrated partners to the global enterprises, shaping areas such as clinical development strategy, regulatory science, digital health platforms, and data-driven decision-making. So the next decade will be more about scale, specialization, and strategic ownership, positioning India not just as the GCC destination, but a core pillar of global life sciences innovation ecosystem.
I think today for these companies, the thing is not to scale quickly and just manage cost. Today the conversation is how their India center will contribute to the global value chain. So I think there are three things that these companies need to evaluate. The first one is the talent depth and not just the talent availability. They should start investing in building those specialized capabilities that retain over time, like clinical analytics, AI-driven research. Second is the mandate design. The most successful GCCs are built around the clear ownership areas like clinical analytics, regulatory platforms rather than the fragmented delivery work. And the third and the most important, which I feel, is location strategy. Many companies have started leveraging and using this strategy, but I think there is a long way to go. Many organizations should start adopting a hub and spoke model where a strong anchor hub is complemented by secondary locations to access the new talent pool and scale immensely. I think these are the three important pillars, I would say, that would help any new GCCs to scale quickly and faster.
This white paper lays out a vision for how life sciences GCCs can shape the future of global healthcare. To read the full white paper, access the link in the description below.